You are the nurse taking care of a patient who is receiving an antibiotic, clindamycin, for the treatment of an oral infection. Which of the following choices best describes the mechanism of action of clindamycin? A. Inhibition of tetraflate reductase. B. Prevention of folic acid synthesis. C. Inhibition of RNA transcription. D. Blockage of peptide elongation by binding 50S ribosome site. E. Inhibition of DNA gyrase. The answer is D. Blockage of peptide elongation by binding 50S ribosome site. This is the mechanism of action of the antibiotic, clindamycin. Inhibition of DNA gyrase is one of the mechanisms of action of fluoroquinolone antibiotics, such as levofloxacin. Inhibition of RNA transcription is one of the mechanisms of action of bacitracin, a topical antibiotic. Inhibition of tetraflate reductase is the mechanism of action of trimethoprim, an antibiotic that is often combined with sulfamethoxazole to inhibit folic acid synthesis. Prevention of folic acid synthesis is the ultimate mechanism of action of trimethoprim and sulfamethoxazole, both individually and when given together. The nurse is preparing to administer 250,000 units of medication to a patient. The ampule sent from the pharmacy contains 500,000 units per milliliters. How many milliliters should the nurse administer? A. 1.2 milliliters. B. 2.5 milliliters. C. 0.5 milliliters. D. 0 milliliters. The answer is C. 0.5 milliliters. Strength of medication equals 500,000 units per milliliters. Required dose equals 250,000 units. Milliliters of medication required equals 250,000, 500,000 milliliters. Equals 0.5 milliliters. The nurse is preparing to administer 100,000 units of medication to a patient. The ampule sent from the pharmacy contains 600,000 units per milliliters. How many milliliters should the nurse administer? A. 2.4 milliliters. B. 0.2 milliliters. C. 2 milliliters. D. 1.5 milliliters. The answer is B. 0.2 milliliters. Strength of medication equals 600,000 units per milliliters. Required dose equals 100,000 units. Milliliters of medication required equals 100,000 over 600,000 milliliters. Equals 0.16 milliliters. 0.2 milliliters. The nurse is preparing to administer a bag of heparin sodium solution with a mix of 120,000 units per 400 milliliters intravenously. At what rate should the nurse set the infusion pump if intending to deliver 1800 units per hour? A. 6.0 milliliters per hour. B. 7.8 milliliters per hour. C. 2.2 milliliters per hour. D. 1.3 milliliters per hour. The answer is A. 6.0 milliliters per hour. According to the question, 120,000 units is mixed in 400 milliliters. So 1 unit is in 400 over 120,000 milliliters. Hence 1800 units is in 400 over 120,000, multiplied by 1800 milliliters. Equals 0.6 milliliters. Hayden is a 9-year-old boy who has been admitted to the emergency room with a fever. He weighs 71 pounds. If the dosing guideline for acetaminophen is 10 mg per kg at 4-hour intervals, how many milligrams of acetaminophen should the nurse administer? A. 293 mg. B. 458 milligrams. C. 323 milligrams. D. 710 milligrams. E. 620 milligrams. The answer is C. 323 milligrams. 2.2 pounds equals 1 kg. So, 71 pounds equals 71 over 2.2 kg equals 32.3 kg. Prescription dose of acetaminophen equals 10 milligrams per kg. Dose required equals weight multiplied by prescription dose equals 32.3 multiplied by 10 equals 323 milligrams.